Good afternoon. My name is Dr. Rajesh Nath, and I am working in Faculty of Pharmaceutical Sciences, Rama University, Kanpur, as an assistant professor, which is accredited with NAC Grade A. Today, in this video lecture, we are going to discuss about tissue permeability of drug and various physiological barriers that are present in our body. Okay, so let's start with tissue permeability. What is tissue permeability? Basically, it is the permeation of drugs from our extracellular cells to our intercellular cells. It basically determines the distribution of drugs to target and non-target sites. So there are lots of drugs that actually works on our target site, for example, site of action. Then the key component will be our ADME, that is at absorption, distribution, metabolism and excretion. With that, we are going to discuss about first what is drug. A drug is any substance that basically modifies or explores the physiological system or the pathological state of the particular patient. It is basically for the safety as well as the efficacy. Safety and efficacy. These are the two things that we are using the drugs. So now we will see that what are the various transport mechanisms that takes place for the transport of the drug to site of action. For the first one, that is passive transport. Passive transport is basically where we don't need energy. It is energy independent, where there are two subtypes. For example, first is simple diffusion, where a bulk amount of drugs get transferred from extracellular to intracellular, and the main thing that it consists of that the movement will be from higher concentration of drug to lower concentration of drug. Second one, that is facilitated diffusion. It is basically carrier mediated. That means it needs a carrier, either protein or any other molecule. So with this I am giving an example. So here you may see that a layer is there which is semi-permeable membrane. Where the molecules are moving from higher concentration to lower concentration. It always happens in simple diffusion. So here it is a blood vessel. You can see it is the vessel both sides, and there are some free radicals. These are free drugs that move to the site of action. These are free drugs that move to site of action, and there are also some drugs that bind to the particular protein, that is albumin protein, globulin protein. There are various types of protein where the drugs get protein binded. For example, if we take a 500 mg of any drug, it will get permeable into our bloodstream. So take consideration that 250 mg drug gets into our stream, and outside we have 250 mg. So there will be equilibrium, 250 mg outside and 250 mg inside the cell. But as we know that the movement will always be from higher concentration to lower concentration. So here we cannot maintain the equilibrium. We have to make higher or either lower concentration. So here the 500 mg, whenever it gets into our bloodstream, the free radicals get attached to the proteins present in our plasma, and the rest of the free radicals that are present, the free drugs, they get moved to the site of action. And also the drugs that are binded to the particular protein, they also get released whenever the site of action requires the amount of drug. So that's why the flow keeps continuing, because whenever there will be equilibrium, there will be no transport of drug, but when there will be unequal concentration, there will be flow of drugs. Third is our active transport. Active transport is a such transport mechanism where we need energy in the form of ATP. ATP is formed in our mitochondria basically, that needs carrier. You can see in the diagram that the molecule is get transferred through a channel, and it needs a mediator. So it is an energy dependent, and the movement is from lower concentration to higher concentration. Fourth, it is endocytosis. What is endocytosis? Basically it is engulfment of what? Any kind of molecule, either it is antigen or you may say any kind of particle. For example, any bacteria that is coming outside to our body, it will engulf. And also endocytosis is basically classified into two categories. One is phagocytosis, another one is pinocytosis. Phagocytosis is basically where the solid particle gets engulfed. You can see whenever a substance is coming, the cell gets deeper and it comes and covers the outer layer. It makes a vesicle where the molecules get absorbed. In this way, the solid particle gets absorbed. It is called phagocytosis, and when it will be liquid, it is called pinocytosis. Now, let's talk about the various barriers which is present in our body. But before that, let's discuss why do we need barrier? Because a barrier is a protective line of defense, first line of defense, that acts as a gatekeeper. It provides protection from the external harm that we get from the environment. For example, skin barrier. It prevents us from the moisture escaping. And also, it maintains the hydration as well as avoids the pathogens from entering our internal environment. Now, there are some rate determining steps that determine that what amount of drug or what quantity of drug will enter in our bloodstream. For example, first one is physiochemical property. Physiochemical property. Now, inside that we have two subcategories, that is molecular weight. So there is the molecular weight of molecule, any molecule. The molecule which having less than 500 to 600 Dalton will easily cross our capillary membranes. Then we have partition coefficient, pKa, that is pH of blood and extracellular fluid when will be around 7.4, that is neutral almost pH basically. They play a role in degree of ionization and diffusion of drugs into cells. Means whenever the pH will be equal, the drug will easily transfuse into our intercellular cell. Then let's see our first membrane, that is cellular membrane barrier. Our cellular membrane is basically made up of biphasic lipid layer. That's why only lipophilic drugs can pass through our cell membrane rather than hydrophilic drugs. And also there are some size that is less, that is more than 50 Dalton can pass through only through active transport. No passive transport drug can get transferred. Next, we have skin barrier. As discussed, skin protects us from external environment. Then it is mainly formed of stratum corneum, and it is highly keratinized with lipid matrix. That's why hydrophilic drugs are limited here. It doesn't penetrate. For example, if I put water in my hand, it will not get penetrated easily. But if I put any lipophilic drug, it can get entered through some external influence. Then we have triple B, that is blood-brain barrier, the most important barrier in our physiological system, where we can see two important junctions made up of pericytes and astrocytes. These are the two cells, two layer of cells that bind with each other and doesn't allow most of the drugs to pass through it. It prevents toxins and many drugs to enter. And if I say about passive diffusion, it is restricted here because molecular size of less than 700 Dalton with high water and oil partition coefficient will not pass. For example, levodopa, diazepam, morphines, these are the drugs that can penetrate easily. Then here is the example, here is the diagram basically. You can see here is astrocyte, pericyte, and they form tight junction. Next, we have blood cerebrospinal fluid barrier. It is basically similar to triple B, that is blood-brain barrier, but there is only one difference, that is we have here choroidal cells. Earlier in triple B we have seen astrocytes and pericytes, but here we have choroidal cells. Next, we have blood placental barrier. This is the barrier which is present between mother and the neonate, where the fetal trophoblast basal membrane is present and endothelium constitute placental barrier. And the drugs that will pass, that are lipid soluble drugs. Okay. And one important thing, that the placental barrier thickness during the initial trimesters, it is of 25 micron in size, and till the full term it becomes 2 micron. Also, the molecular weight less than 1000 dalton can easily pass by passive diffusion. As you know, passive diffusion doesn't need energy, it is energy independent. For example, thalidomide, heparin. Thalidomide is an teratogen. Now, what is teratogen? Teratogen is the drugs that causes malformation in our neonates. That's why these drugs should be avoided. Then we have blood-testis barrier. In the blood-testis barrier, the main junction is formed by the Sertoli cells. They form tight junction and it doesn't allow most of the drugs to penetrate it and entry of the drugs to the spermatocytes and the spermatids. For example, cisplatin, it is limited in penetration to our blood testis barrier. Along with this, we have lots of other physiological barrier. For example, blood retinal barrier, blood ocular barrier, that is blood in our eyes, then blood milk barrier, and it has some clinical relevance in special population. So, I am going to conclude with this, that physiological barriers create a protective role as well as they significantly influence the pharmacokinetics, basically absorption, distribution, tissue permeability, metabolism, excretion, and the last thing, that if we understand the various barriers, then we can easily provide rational therapy for the particular patient. Thank you.